So can you just give us a little bit of history about osteopathy? I know lots of people, it's sort of, it's a word that's in the community, and there's lots of people now talking about osteopathy, and they're not really sure exactly what it is or sort of where it came from.
Well, osteopathy has been around since the 1800s. Andrew Still, who was an MD at the time, realized that there was a way of treating people different than what he was used to as an MD. And this involved using his hands to correct anatomical dysfunction. So he drew from a number of things in the past. There were certain techniques that were Cherokee, and he realized that there was a big relationship with living anatomy and disease. And he felt that if he could correct the dysfunction physiologically, that healing would follow. And he proved that to be true by treating people with his hands on a regular basis and getting fairly immediate results without prescriptions or drugs.
All right. So in the beginning, I guess he called it osteopathy because he thought maybe that the bones were more involved than anything else?
That's true. He felt that he could find difficulty or dysfunction with the skeletal system. But osteopathy has evolved. That's one of the benefits of it, based on its tenets. And it has evolved now to encompass all of the body. It's a very holistic approach. It looks at the nerves, the muscles, the viscera, the fascia, and so on.
Right on. I was going to ask you, what is it about this modality that really sort of piqued your interest? You're a massage therapist originally by that's sort of your umbrella trade, but what was it about osteopathy that sort of grabbed you?
Well, again, it was a stroke of luck that some of the instructors at the college that I went to for massage therapy were enrolled in the osteopathic program. And on those special days when they threw the lesson plan out the window, they would show us some of the things that they'd learned. And right away I was fascinated by the difference in the techniques, but also very intrigued by the philosophy. For me, osteopathy has a lot to do with the philosophy and the approach to healing.
All right. And you mentioned something about the tenets of osteopathy. I have a bit of background in it. There's certain sort of procedure that you follow when you're doing a treatment, like sort of where you get your mindset?
That's right, and that's what the philosophy is based on. So the first one is that the body is a unit, and you can't separate one from the other. Right. And that includes emotions and spirit. Also, structure and function are interrelated. You can't separate those as well. The last one talks about reasoned treatment is based on taking those principles and applying them to the body that you're working on.
Nice, nice. What kind of conditions would you sort of treat normally with osteopathic?
I've had in my 15 years of treating people, I've had a very wide range, and I appreciate the challenges of that. I mean, I've got your frequent flyers, your headache, repetitive strain. Yeah. But I've also treated the Toronto Maple Leafs for concussion with some osteopathic techniques. I have clients that have ALS and MS. So it's a very wide range of pathologies.
All right. So is there what's the biggest difference if I were to come to you for massage treatment versus an osteopathic treatment? What might be one of the main differences that would happen?
I think that one of the main differences is that you can be treated with your clothes on. Some people are more comfortable with that. That's probably the main difference, but I really feel that, again, it boils down to the philosophy and the approach at the onset of the treatment. It's a way of thinking, and osteopathy, in my view, has been able to bring resolution to dysfunction where other modalities have failed.
All right, excellent.